Is my wisdom tooth infected, or is this just how it's supposed to feel? Hi everyone, my name is Whitney and I'm a dental hygienist here to talk about pericoronitis, which is a wisdom tooth infection. First off, what exactly is pericoronitis? So whenever your wisdom teeth start to erupt, they cut through your gum tissue, right? Just like all of your other teeth did when they first erupted when you were a kid. Super normal. But sometimes, and oftentimes with wisdom teeth, they only partially erupt because they get wedged inside of the bone or against another tooth. As a result, the gums don't pull all the way back from the chewing surface. You're essentially left with a flap of gum tissue that's still covering part of or the majority of your wisdom tooth. So this slightly open area next to the flap allows food, plaque, and other bacteria to get underneath it in a place that you can't clean. Bacteria begin to thrive in that place, leading to an infection or an ulceration. So how do you distinguish between normal wisdom tooth eruption pain, normal teething in a sense, versus pericoronitis or an infection? General rule of thumb is that with regular teething, the soreness will usually be on and off, discomfort, swelling, or aches coming from that area of your mouth. So if it's annoying but not the end of the world, annoying type of discomfort, it's more likely just regular teething. Whereas pericoronitis tends to be much more painful. The sharp ache may even make it impossible to chew in that area of your mouth. Plus, you usually can visibly see a swollen gum flap around or over the wisdom tooth. There are even cases where pericoronitis causes swollen lymph nodes, jaw spasms, and facial swelling. You might also notice a bad taste in your mouth. As bacteria get trapped under that gum flap, which you'll probably feel with your tongue as well, that bacteria will start to multiply and produce smelly byproducts as well as necrotic tissue. This can lead to a stinky situation that tastes just as bad as it potentially smells. And in addition to the swollen gum flap that you're feeling with your tongue, you might also notice red gum tissues and possible bleeding, maybe even pus around the tooth. Most pus has a salty taste to it, and you might even notice it coming and going. So what actually causes this? What causes pericoronitis? Like we said, pericoronitis is generally triggered by the bacteria that's trapped under the gum flap in that area. And the reason this bacteria gets trapped is usually due to impacted wisdom teeth. Even if you're brushing and flossing properly, you can't properly clean under that gum flap. You just can't. It's not your fault. Trauma is another leading cause. As your wisdom teeth erupt and the gums over them stretch and pull back, you might accidentally bite down on that gum flap. Or it can also happen from eating sharp foods like tortilla chips or something, or even accidentally slipping with your toothbrush and jabbing it into the gums. Other reasons pericoronitis may occur is because of premature tooth loss and crowded teeth. Teeth are programmed to fall out on a specific timeline, right? I have a whole video on that if you'd like to learn more. But the good thing about this is that normally your dentist or orthodontist can correct this scenario with early intervention as a kid. And lastly, poor oral hygiene. There's only so much you can do to clean around a gum flap, but sometimes if you visit your dentist, they can actually give you a syringe to flush that area out with salt water or with mouth rinse. You can also use a water flosser to clean it each day on a gentle setting. These are steps that are sometimes helpful as your tooth is erupting through the gums, but it might not be practical for long-term purposes. So if you do have pericoronitis, how do you treat it? How do you get rid of it? The first step is having your dentist professionally clean out that area, flush away all that loose debris. After that area is physically cleaned out, depending on the severity of the infection, they might prescribe you an antibiotic, which will help reduce inflammation and ease the pain. However, it will not prevent reinfection from occurring. It will still come back. Antibiotics are just used until you can fully treat it. And to fully treat it, you will usually have two options. They both depend on the placement and eruption pattern of your wisdom teeth. So if the tooth or teeth are still erupting and expected to come into place and they are otherwise healthy, your dentist may be able to use a soft tissue laser to remove the gum flap that's covering the biting surface. Or the other option, and the more common option, especially if you're having a hard time reaching back there to clean it, there's no reason to just remove the gum flap if you can't continue to clean the tooth. It will oftentimes make more sense to just remove the wisdom teeth entirely. So to reduce the risk of infections, usually the best thing to do is to remove the tooth for the sake of your overall oral health. I do have a bunch of wisdom teeth videos more about the extraction procedure, post-op instructions, etc., which I will link in the description box if you'd like to learn more. And lastly, fun fact, studies have shown that about 81% of patients experience some type of pericoronitis, and it tends to be the most prevalent in people between the ages of 20 and 25 years old. So if you're unsure whether or not this is just normal wisdom tooth pain you're having because they are erupting versus actual infection pain, schedule an appointment with your dentist for answers. Never try to self-diagnose. I'm sure you know that, but it's worth mentioning because unfortunately, pericoronitis will not go away on its own, even if the symptoms temporarily improve. You'll need a dentist to get to the source of your swollen gums and remove the source to provide long-term relief. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. If you want more teeth Talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth. Wisdom.